Hello, everyone. My name is Pedro Macias. Today, we will be exploring novel psychoactive substances, NPS, societal impact, and differences from traditional illicit drugs. Our learning objectives will be to understand what novel psychoactive substances, NPS, are and how they differ from traditional drugs, examine health and legal challenges surrounding NPS, explore prevention strategies and societal impacts. NPS are emerging rapidly and often misunderstood, and we are going to talk about why all of this matters. Novel psychoactive substances, or NPS, are synthetic compounds designed to mimic the effects of traditional illicit drugs like cannabis, LSD, cocaine, while remaining legal by modifying their chemical structure. These substances often marketed with names like bath salts, herbal incense, or legal highs, quote unquote. They have rapidly become a public health concern due to their unpredictable effects, very high toxicity, and widespread availability. Here is a reference video for you to help us understand a little more. The emergence of NPS accelerated in the early 2000s, particularly with the rise on online drug markets and global distribution networks. According to the United Nations Office on Drugs and Crime, or the UNODC, more than 803 unique NPS had been reported by 2018 across over 100 countries, reflecting their widespread and growing use. Their appeal lies not only in their perceived legality, also in their ability to circumvent existing drug control laws. Common examples of NPS include synthetic cannabinoids such as spice and K2, synthetic cathinones, commonly referred to as bath salts, and synthetic opioids like U47700. These substances are frequently more potent than the drugs they are intended to imitate. For example, synthetic cannabinoids have been linked to severe toxic reactions, seizures, and fatalities, largely due to their unpredictable pharmacology and extremely high potency. Young people, especially teenagers and young adults, unfortunately make up the majority of NPS users. This group is particularly vulnerable due to experimentation, things like peer influence, and misinformation. Reported widespread NPS use among individuals in nightlife settings where users are often unaware of the actual chemical composition of the drugs they consume are also a very vulnerable demographic. Of course, that demographic is a little bit older than teens. The health effects of NPS are dangerous and diverse. Users may experience things like hallucination effects, paranoia, seizures, cardiovascular problems, and death. Because the substances are often mislabeled and altered to evade regulations, the risk of overdose or adverse reaction is significantly heightened. This has contributed to a surge in emergency room visits, particularly among individuals aged 18 to 25. The legal landscape surrounding NPS is particularly complex. In the US, the Federal Analog Act aims to regulate substances that are substantially similar to already banned drugs. However, proving chemical and pharmacological similarities in court can be extremely challenging. European agencies like the EMCDDA have advocated for generic class based bans to manage the rapid emergence of new compounds more effectively, which the US hopefully will follow. In case you're wondering what EMCDDA stands for, the European Monitoring Center for Drugs and Drug Addiction. NPS differ from traditional illicit drugs not only in their legal status, but also in their chemical volatility. While substances like cocaine and heroin have been extensively studied, most NPS lack sufficient toxicological research. This unpredictability adds a layer of danger, particularly when doses and ingredients are unknown or mislabeled. May I emphasize that these inconsistencies contribute to user confusion and complicate emergency room treatment when users have dangerous responses to these chemicals. Here's another video for your reference.
Not a very large number of users that end up in the hospitals, but when they do, sometimes very severe toxicity. With the NPS, a lot of the symptoms that bring them in are agitation and aggression, and those are the ones in the extreme cases that are most difficult to treat and require large amounts of sedation, quite a lot of resources to contain the user and keep them from hurting others and hurting themselves, and in a few cases also death. When responding to a patient that comes in with signs of toxicity and we don't know what kind of NPS they've taken or whether it's an NPS at all, what we're going to do is the same we do with any of them, is treat their signs and symptoms, control agitation, and control things like hypertension, tachycardia, and especially hypothermia.
NPSs are less studied, more unpredictable than drugs like cocaine and heroin. The media portrayal of NPS adds another layer of difficulty. Sensationalized and often misleading, they often create panic and understanding and underestimating, the seriousness of the issue. The um, idea that these are safer than regular drugs infiltrates the vulnerable minds of the youth, which is very dangerous because the young people don't have no clue what exactly they are taking, thinking that they will be as safe as, well, the illicit drugs are not exactly safe, but they think that they can partake in these types of NPSs with the same effects as the popular illicit drugs, which have detrimental effects. The societal consequences of NPS proliferation are significant. Health systems face increased pressure from emergency cases, like we talked. Law enforcement struggles adapt to ever changing drug formulations. So it's very difficult to track them down because they're available online to all types of ages. And they're always used with different code words, different code names for purchasing. So even if law enforcement tries to infiltrate online sources, there's they're hard to detect on both fronts, the chemical and the websites. Um, the public education campaigns have to be improved. The health curriculum, the prevention and spread and harm of NPS requires, like a strong cup of coffee, a very robust public education campaign. And we need broader community engagement and we need educational institutions to update their drug education. Our textbook talks about that, and NPS awareness and harm reduction, that we do need to update our education systems so that young people in schools can be aware exactly of these dangers. International collaboration is essential. Agencies such as the UNODC promote early warning systems and data sharing to track the spread and effects of NPS. However, gaps remain in clinical knowledge and treatment protocols. Without significant research, healthcare professionals may lack the tools to effectively treat NPS related conditions. In conclusion, novel psychoactive substances represent a fast evolving and dangerous category of drugs that pose a significant threat to individuals and society. They differ fundamentally from traditional illicit drugs in terms of their legal ambiguity. And like I stated, we lack the research and we do not know their effects because they're constantly evolving and changing. So the unpredictable effects of these dangerous drugs are another reason for concern because we do not know how people are going to react, like with aggression or violence, and it's been very dangerous and even causing more deaths than COVID and cancer, believe it or not, in young people. Addressing this challenge demands a coordinated effort involving legislation, public education, research, and global cooperation. NPS is a growing global threat. Addressing them requires international collaboration and modernized drug policies and evidence based education. I would like to thank you all for joining me in understanding more about the NPS, the novel psychoactive substances. It's been a pleasure on this journey with you together in learning about this. And here are some discussion questions for us to ponder for ourselves and answer. How can schools better educate students about NPS, which is very important? What are effective legal strategies for these emerging drugs? Can harm reduction effectively address NPS dangers? And what community based solutions are needed? Once again, thank you so much. It's been a pleasure. Take care.